Hello and welcome everybody. I am here with Jo Hopper from Joy. She's going to do a demo of the Joy Marketplace. Please be aware that this session will be recorded and will be available on YouTube. Okay.
Hi everybody. Thank you so much for having me. So I thought what I would do is start by a brief presentation. I'm not a massive fan of PowerPoint, so I'll keep that bit brief. And then I will go into a demo of the marketplace, the Joy Marketplace live. As Claire said, just to be really clear, this is being recorded so that it can be distributed and shared widely. And I think it's probably going up on YouTube. So yeah, just so everybody's super aware of that. And I'm clearly not ready for my close-up, but there we go. So the Joy Marketplace is a part of the Joy bigger ecosystem. So I am going to run through a little presentation which might just give a bit of context for what Joy is and why we exist. So I'll just, there we go. When you're ready. Oh, my computer's running very slowly this afternoon. Right, there we go. Okay. So Joy is a large system. It's designed to support engagement with community services, and we do that largely through primary care and working closely with personalised care teams like social prescribers and health and wellbeing coaches. But as a part of that, we have this really fab online directory of services which can be accessed publicly by anybody. And we're really, really keen to make that ecosystem as rich as possible with as many great community services on there as possible. It's a really great way to talk about local services, particularly grassroots organisations who may not have sort of, you know, a big presence online otherwise, and it's really accessible because it is just an open website that anybody can go to and search on. So Joy exists to add about 10 years to life expectancy through social prescribing efforts. These stats are a little bit out of date. We actually cover about 8 million patients across about 1,500 different organisations across the UK, and we are growing every day. There are sort of lots of challenges when looking to access services and make referrals into services from both sides of the fence. So quite often there can be outdated information or unclear websites. Completing that referral can take a long time. And it can often be difficult for the services that are referred into to sort of feedback on outcomes. You know, did the person attend? Did the service feel that the service user got the most out of it? That kind of thing. And that's all really sort of key information for everybody to have at their fingertips and to understand. Lots of people see improvement after accessing a community service, 53% based on the data that we've collected. Sorry, not sure what that was doing there. Went funny. But yeah, so 53% of people say they felt an improvement after accessing a community service. So it's a really crucial role that those non-clinical services in the community deliver. The role that Joy does the marketplace does is it kind of sits in the middle of those referrers, so GPs, social prescribers, other primary care providers, and is a pathway and a conduit for them to refer service users into community and voluntary sector organisations. So if you as a patient were to engage, you know, or want to engage with clinical services, you could do this directly through the marketplace or through one of those GPs or social prescribers. Key benefits to using the marketplace. So we find that on average, referrals are 5 times quicker for people to send. And we get that really important feedback on outcomes. So we start to see and really be able to shout about the impact that those services have, and also feedback to the services about additional gaps in provision that they could maybe start to fill. So the key bit is, how do you find those services? So in a minute, I'm going to demo for you the Live Marketplace website, so you can see how easy it is to search for services in your area and then refer yourself or refer somebody else into them. I'm gonna stop sharing my screen for that bit there. So should we go straight into the demo? Is that going to be a good next move? Cool. Okay, let me make sure I've got my right screen up. Okay. Okay, so this is the Joy Marketplace. So it's very simple. It's just services.thejoyapp.com, and anyone in the world can go to this website and see lots and lots of really great community and voluntary sector services listed here. As a user of the website, if you were wanting to search for a service to refer yourself into or to refer somebody else into, you have this little search box at the top. So you can search by a keyword. So that might be like gardening, if you're looking for, if you've got a green-fingered friend who you want to get involved in a gardening group, or it could be money advice, if maybe you're wanting to support some sort of financial, looking for some sort of financial counselling support of some kind, or debt advice, that kind of thing. And then you can pop in your location. So I'm gonna just pop in this because I know.
There are things in Derby already, and in
There
Burton-on-Trent.
aren't they? I was trying to think. I should have had a Derby postcode in my head. I might just put in Derby, although that, again, Sutton's quite big. So I select that from the drop down. So because I'm just going to do that again so you can see. So because I selected from the drop down, this sort of drops a pin in Joy, so it can then tell you how many miles away different places are from where you are, and you can put an exact postcode in here, and then it will give you really exact distance information. And then we click the search button.
And of course, Sutton would have been more populated, wouldn't it?
We've been in Sutton for
Yes.
for quite a long time, so that's why. And the other reason it popped into my head is because I was just doing some work with them earlier, so I knew we had some money advice places. But as you can see, so this so we've got something that's 11 miles out. So the postcode that it's defaulted to for Derby is DE12AW, but obviously you could put in your direct postcode in there, so your exact postcode of where you live, and then it will tell you just here on each little service listing card, as it were, how many miles away that is. And then what we can do is we can click in and see the details of that service. So this is like a front card or a front page for this service. And then if you go into it, you can see that you get lots more information about the service. So it will give you lots of information about exactly what they offer and what they provide, and what support they give. And then they have some sort of service statistics. So how quickly can you expect a response from your referral, whether that's a self-referral or you're referring someone else in, and what percentage of referrals they generally accept. 97% is a nice, good, high number. And then they also can categorize themselves within our system to help make themselves even easier to find. They can provide any additional needs that they cover. So if somebody has like mobility issues, they can say about that. If somebody has sort of vision or hearing impairment, they can say they support that. Obviously, this one has said they're non-English speaking friendly, which is brilliant. They can say how long their waiting list is, and then they will say whether they accept direct self-referrals or not. So this one only accepts referrals from professionals. So that would be people like your GP or your social prescriber. So as somebody, as a patient, just a general member of the public who's looking to use this, if you see that professional referrals only, but you think that this is a service you would really like to access, it's a really good idea. Get in contact with your GP surgery and they'll be able to find you a pathway into it from that professional angle. So that's really useful. I'm just going to show you a little bit more on the search, because obviously this has come up with a few different solutions for us here. Oh, look, so there's adult social care. So what we do on Joy is we prioritise in the listings any that enable us to do direct referrals through Joy. So any listing that I can click this refer now button on will be prioritised in the search results, so that I can just quickly fill out this form and submit it, because that in the Joy world, that's the ideal scenario, because that's how we manage to gather all that lovely data around response times and attendance and service outcomes. But we do also accept services that are signpost only, so maybe they just want to say that they're available but you can't directly refer into them, and those will list, but they'll just be not prioritising that list. So we can see that Derby City Council adult social care is just 0.6 miles from where the postcode was that we put in, but there's no direct referral through this pathway. You can go on, you can read about what the adult social care offers, but there's no direct referral pathway into it. So you would need to use one of these contact options here to reach out to them to find out what the best pathway is to engage with adult social care team at Derby City Council. Other ways that you can filter your search is, you'll see over here, you can select whether you only want to see free services or whether you're happy to see services that are paid for as well. Most services on here, if they are paid, it's a sort of nominal fee, maybe to cover costs and that kind of thing of sort of, you know, lunch clubs and things like that. You can select by a category. So you'll see just over on the left-hand side, there's all these different categories of service. It's up to the services themselves to put which categories they're under. So it's not infallible, but as long as the service has placed their listing under the right category, then you would be able to click that, and that would filter the responses to your search to just show you those particular services that fall under that category. Again, if you did have maybe a vision impairment or English is not your first language, you could filter to only show services that say that they cater to that specific need. And one of the really good options is to filter it by distance. So you can pop in your postcode and say, only show me services within 3 miles or, 5 miles or something like that. And then it will really limit those search results to show you only those that fall within that particular area. So don't forget, we're still limiting our search to just money advice. But if I was to put in, I was to just search.
It's worth making the point that I suggested Derby, but Derby will be more populated, won't it, at a later date?
Exactly, yeah. So this, I mean, that's all a part of what we're doing here now, isn't it? You know, it's very much about how do, making sure that as many services as possible are on here and are accessible for people to utilise and to view. You know, it's about information sharing, so what is out there, what is possible, and it's also then about making it really quick and easy as possible for people to then access those brilliant community services that a lot of them are just on people's doorsteps. So yeah, it's all about sort of shouting about that. But yeah, you can see now that I've taken off the specific bit about money advice, there's lots more that have come up really close to that postcode, to the Derby postcode that I popped in. I'm trying to think if there is anything else in particular I should show you. I'm not really particularly sure there is, because it is just, kind of very simple. Oh, the only thing is, obviously at the top here, obviously for people that where English is a second language, you can top left drop down and use this Google Translate option to translate the whole website into your first language, to make it more accessible for you. But yeah, that's about it, I think, for
The plan is that we're stop recording now, so people can feel